Hello, friends. A very good morning to RFA champions to be. I hope you all are fine. Is my voice audible and clear to all of you out there? Hello. Hi, Chin. Good morning. How are you doing?
Morning, Dr. Ali from my side. How's
Thank you
everyone?
so much. Hello. Hi, Butaina. Hello, Tahira. Thank you very much for joining in. And many of them are taking flights. Big hello to Adam, just reaching Portugal from Spain. Hello, Ahmed Mustafa. Hi, Shiny. Hello, Anam. I know you're taking a flight as well. Hello, Archana, my dear. Asima, hello. All of you, Allah. Butaina is here. That's wonderful. Intasar. Kazi has reached Portugal. Mona, hello. Murtaba, Niven, my dear. Hi, Pooja. I know your preparation is going on as well. Rania, Rahat, Sama, Samina. Saso has reached yesterday. She messaged. Shana is there as well. Sheila is taking flight. Sunanda, all those, Alvina. Warm welcome from the entire team of RFA Theaters. We stood beside you when we started, and we are with you guys till the last moment. Hello, Bataina. How does it feel, my dear? How is everything?
Hi, Mom. I'm fine so far.
Settling in well?
It was a long journey as we didn't have a direct flight about it.
I can
But
totally understand.
yeah,
So it
but at
must be
least we reached.
tiring. No, take
Yeah,
rest, my dear. So welcome to all of you out there. We have been preparing well. Today we are meeting to make the last minute booster to make your morale be on the highest of its limit. Why? Because this is what's required for the Osce at the last moment. The way of success is actually the continuous pursuit of knowledge. We always say that staying focused and staying confident is very important. Camelia will be joining in a bit. She was also extending lots of wishes to you guys with lots of prayers from the entire team. Why are we meeting today, Chin? Why, Chin, we keep on preparing, but when it comes to appearing in the exam, still the heartbeat gets faster. There's some sort of an anxiety at the back, and lots of things they are coming up in your mind, and we tend to lose our focus. Why this happens, Chin, and what do you think we should be doing now at this very last moment?
It's very important that we have a very, collective of all the thoughts, whatever that we have studied up to date, and stay calm. And most importantly, 24 hours or 48 hours for whichever exam, Saturday or Sunday that you're taking, stay very composed. Have plenty of rest and make sure that you are very adequately hydrated. So I think sleep is the most important key, because that's the very important point, because you cannot have that cloud in your mind, because you need to stay very clear and very focused on this one day.
Absolutely correct. Niven and Mona have just joined now. Warm welcome, Niven. Thank you very much, Mona, for joining in despite being busy and despite being in the last minute arrangements. I would like to say that, see, it's very natural to have an adrenaline rush before exam. It's quite natural to have a raised heartbeat and those flooding of thoughts, bombardment of thoughts that, oh my God, what would happen? What if I don't know one station? What if I'm blank in making the PowerPoint? What if I'm not able to read the complete study and how to critically appraise? These thoughts are pretty natural. Stronger is the person who can deal with these thoughts in the last 24, 48. Stronger is the person who actually understands that now what is required is my confidence. What is required is that how I bring up the best in my presentation. See, you people have done all the aspects of these stations. Now, if you produce it beautifully, if you present it without being shaky, the job is done. This is what they're looking at. They have seen you in your theory part. Now they want to see you head to toe. That how do you present? Now is the time that you have to tell yourself that there should not be any stress, because stress would cause fumbling. Right? So I'm really clear on this, that the person who would stay composed would be the person who would ace it, and the examiners would definitely love the candidate who is confident. This is what they're looking at. It's an obstetrician and gynecologist. Your confidence is what is required in different situations. Tell yourself that I would do it. I would be doing it till the last moment. And as Chin has emphasized on the point, last 24 to 48 hours, more than your study, your relaxed attire matters a lot. So that you have a very good presence of mind when you're speaking out there. You've got a perfect attire and you've got a wonderful focus, so that you understand that what examiner is asking for, what he actually wants from you. Sleep well, eat well. Please take a slight walk. I want that you guys do not have stress at all. This is what we require in the last moment. How to bring the best in these 24 to 48 hours, Chin? What should they be concentrating upon now?
Very importantly, I don't think you should be learning new stuff in the last 24 to 48 hours.
Yes, agreed.
Do not dwell into unnecessary stress and unnecessary new thing. Focus on what you already know, like what Dr. Sidra Ali has mentioned. It's nothing too tricky about it. You already are being prepared throughout the module of the course so far in the last 2 to 3 months. So just regurgitate it out. Show that you are very confident in front of the examiner, because that is what they want from a candidate that will shine. And that's the obstetrician and gynecologist that they want, at the end, as an end result of this.
I would just like to add in that, have a clear concept that what OSCE is. It's like your assessment in terms of being objective, structured. So I want you all to have a good structured idea for yourself. If they give you a communication, it's a breaking bad news. You know the lines. I want you to be perfect in your empathy. They're testing that how good you are in handling such a sensitive situation. They're looking at you that how empathetic you are. How much time do you give the patient to get settled? If you've got a station in explanation of a condition, for example, HMB, please ensure that you keep on checking the understanding of the role play. Are you with me? Are you following me? Am I clear so far? These few steps, no matter any topic comes out of this world, the pattern remains the same. The template which we have provided to you, that remains the same. It is an idea that you people know how to be structured. Consider yourself in front of patients that you're in your clinic, and we never be shaky in front of our patients, right? Because we know that nobody is assessing us out there. We are the best. That's why the patient is with us. So we are confident there when we are dealing with the patient. What's the difference in exam? At the back of your mind, you have this feeling, whatever I'm saying, I am being analyzed for that. I am being assessed for that. And it's a very common feeling, and it's pretty natural to feel this way, that when you come to know that you're being analyzed, oh my God, you start having shaky attire. You start feeling lack of confidence, because if somebody is assessing you, you just feel you're just walking on a track and somebody looks at you head to toe. You feel, oh God, oh my God, am I wearing the right shoes? Am I wearing the right dress? So you people have to just take this thought out that I'm not being analyzed. I am here to communicate with these patients like I do that in my clinic, like I deal with them in my daily routine. I'm going to break the bad news of a cancer like I have been doing earlier in the practice with Chin, Camellia, and we as a team. We have been coaching you that this is what you have to do. Please change your mindset before the exam. There's no examiner who's assessing you. You have to do your best, bring out your best. If you talk to patients, you experience that in your clinic, you have to do the same. The way you people have been taking the history, the communication, the pauses, the lines, the empathy, the check of the understanding, that you have to give information in chunks and do not speedily go through the entire topic with the patient. Give the information leaflet, connect to the support group, connect to the counselor. These are the points that would help you in communication. You should be knowing that these stations, they would have these standardized patients, the role players who know. Ensure that you get connected to the colleagues when required. May that be your neonatologist, may that be your anesthetist, may that be the surgeon who has the expertise for some complications like a ureteric injury or the bladder injury. Ensure that you are taking everybody together and do not do everything alone. If you need to discuss with a consultant, do that. If you need to get the discussion with the neonatologist to make a decision of an early delivery, do that. The patients which are going to be provided to you, they are trained role players. If at all they're not understanding anything, it's absolutely okay. Please ask them to repeat that rather than going in the wrong direction. You can say, can you please repeat that for me? May I know, like I remember in my exam, I said that, may I know your height to weight ratio? The patient said, sorry, what's that? I said, okay, are you aware of BMI? She said, no. I said, it's absolutely okay. We are going to check your height to weight ratio today. See, rather than now getting stuck up there, I just managed it the other way around. It's all right. We are going to check your height to weight ratio today. That's it. I just moved forward because my task was that I had to rule out obesity. But if the patient doesn't know, it's okay. You tell the examiner that this is what I'm supposed to do. I would do that myself. Do not get stuck up on anything because you don't know what the response would be, right? Similarly, in molar breaking bad news, last time the students were saying that, the response wasn't very sad. Ma'am, we couldn't offer the tissue wipes or we couldn't offer the glass of water. It's all right. Firstly, it was an online exam, of course. Secondly, if you don't find such a response, it's okay if you think that the acting is not coming up to that standard and that you are actually have to provide the things. You can take a pause. Say, I can see that it's a difficult situation for you. And as a team of doctors, we are here to support you in the situation. And do you want me to continue the consultation, or do you want me to fix another appointment? I can meet you after a little while once you're okay. See, so these type of pauses are expected. Do not expect that what you have learned 100% of things would be like that. But I want you to be composed enough, focused enough that you understand that whatever the situation is, if you have the presence of mind, you would not have a difficulty at all. Jen had been doing superb in the last minute revision, telling you exactly what is the scope of each station. Yeah, he has been telling you that how you have to plan yourself in the OSCE, how to prioritize yourself, how to take breaths and breaks in between. Be organized, because what we want today is that there is no stress. What we want today, Niven, here today, is that you people come up with your best, no matter it's a difficult station. See, one station, if it's a difficult one, it's difficult for everyone. But if you are composed in speaking up the best of your information and knowledge, you people would be coming out at the best out of the circuit. And this is what they're looking at. They cannot fail everyone in the circuit. Even for a difficult station, 1, 2, 3, the best out of all who have been in their performances would definitely be passing that station. Your victory is just around the corner. Don't give up. Be calm, be composed, ensure that your exam essentials that have been done, all those things which you have to take to the center, be sure that your everything is ready. Please ensure a good sleep. Please ensure that you do not overexert yourself. You have been traveling. I need rest from your side. I need good diet from your side, so that whatever you have been doing, that's with you. I would definitely suggest, as Chin has just mentioned a little while ago, do not go to the new things to add on to stress. But yes, the things which you have been doing, and if they're volatile, please try to revise them. Stay hydrated. Tell yourself that, no, it's fine. I'm just there to speak up whatever I have been doing earlier. Do study, but do not overstudy. Overstudy tends to lose your confidence, and this is what we do not want at the last moment. Jin would quickly do a recap of each station so that it's in your mind that what we are expecting as per the college recommendations and what they have decided for this exam. right? For each thing, keep the solid points in your mind so that once you're there, you are giving your best. Chin, from the
Yes.
start, what are we expecting in the exam? Do a quick recap for the best performance skills for each one of the station so that they have a quick idea and a quick recap of the things, my dear. Go ahead. Yeah.
So basically you have 10 stations in the circuit. So only 9 stations out of the 10 is an active station, which means to say it doesn't mean that the preparatory station is non-active. So you are still required to have that privilege of 11 minutes to prepare your 3 PowerPoint slides, okay? 3 PowerPoint slides to be brought forward to the next station and present that as if you will speak to an audience of obstetric and gynecology fraternity. So let's go through very quickly and recap on what the exam is all about. So first and foremost, like what Dr. Sidrali has mentioned, is about communication, communication, and communication. So it's history taking and handing over, summarizing, or have a handover to your colleague, okay, as you would do in your daily clinical practice, okay. The second one, which you have done beautifully, and that's been covered by Dr. Camilla. So those are all your technical skills, like doing an instrumental or operative vagina delivery, abdominal scan and assembly, or doing or performing a laparoscopy, cystectomy, ectopic, or sterilization, so on and so forth. So station 3, like I said, is not to say it's a non-active station, because you are still working in that 11 minutes to prepare your 3 slides. And believe me, I think all of you are at the advantage, because I don't think there are many people who will be preparing the slide will actually write a disclaimer on your PowerPoint slide declaring that you have no conflict of interest, because that's what I did for my exam, and I felt that the examiner was very, very impressed with me declaring that I have no conflict of interest and not being sponsored by anyone having to present on that particular day. Okay, and station 4 will be the next station, where you will bring all your 3 slides to the next station to be talking through that 3 slides in the 11 minutes to the examiner. Then station 5 is about teamwork. Again, this is about communication and how you will work as a team. Station 6 will be teaching the junior, and don't forget that you always have to ask for feedback and check the understanding of a junior doctor or whoever the colleagues that you're talking to and teaching to. So always remember that. Station 7, so Dr. Ali has covered very well with the difficult station, where if a patient is angry, if a patient is frustrated, pause, always listen attentively and keep saying sorry and apologizing. And like what I say in the revision course, saying sorry and apologizing doesn't mean that you are admitting guilt, okay? It's about how you win over the patient. That's very, very important, especially when you deal with difficult patient, difficult family members, difficult relatives. Always say sorry, always pause and let them vent out or ventilate out their anger, their frustration. Then you will see naturally you will win over the patient without much problem, okay? Station 8 will be breaking bad news. So again, being very sensitive, being very empathetic. Sorry that you're being the bearer of the bad news today. So these are all the key sentences that I'm sure all of you have written in your notebook. So revise them tonight. Just make sure that this will be as if it becomes your very second nature at your fingertips when you're delivering this bad news to the patient. Number 9, again, we've gone through. So again, not so much about the structure, because every hospital, every country has a different structure of reporting an incident. So it's more so about reflection of what your thought is, what your insight is on the adverse incident that has happened to your unit or to your trust or to yourself, whether you're involved directly or indirectly, and reflect that upon using the structure that was given in the reversion module to the senior or to the consultant that you're talking to. And lastly, it's again, shared management plan is about a discussion about more complex issue like morbidly adherent placenta or urinary incontinence, so on and so forth. Okay, so believe me, so you all are very well prepared. So just like I said, don't read new things tonight. Just go through whatever that's being covered so far, and you have the asset to go into the exam with all the gears, with all the tools that you have. Thank you.
Perfect. Recap, Chin. Asma has joined. Warm welcome, my dear. I have been just thinking about that, how they have been practicing in the daily reading of an article and then bringing up the best. I can totally understand that the last moments, the thoughts, they are disturbing because lots of things are in mind. Moreover, the administrative things like, just a little while ago, a student in the study group was writing about that missed flight and the connective flight was missed. That these all things adds on to stress. But again, I would say, all the things. You people are so well prepared. I would just say that out of all the obstetric and gynecology OSCE, I won't say that without studying this OSCE one can pass. But what I would like to say is that comparatively, the OSCEs, many of you have taken MRCOD, many of you have taken MRCPI OSCE. So comparatively, the passing is higher, but that does not mean that you don't give your best or you get easy. At this very last moment, I want that you know that you are knowing everything. Then you apply it well. You are sure that whatever you're saying, that is full of confidence. This is what they are looking at. My only suggestion at the last moment is feel yourself to be your doctor's seat of your clinic. Yeah. Feel yourself to be sitting out there so that the heartbeat is not faster, so that any question your patient asks, you know the answer because you have been practicing for so long. Don't feel yourself to be under the exam pattern. The moment you start you're feeling yourself that, no, I'm being assessed for this, you start losing your confidence. The words, they start getting shaky. There's fumbling in your voice. That we do not want. We had been working hard. Believe me, you are very well prepared, more prepared than others. You're best in your circuit. What we need is your confidence. Butaina, Asma, Nevin, Mona, Tahira, all of you, please. The only thing which I request at the moment is have the best of your confidence inside you. Tell yourself that I'm the best and I'm going to do that. Do not doubt yourself. It would be all fine if you're going to just have this feeling. And when you start feeling lack of confidence, tell yourself that, why am I feeling this? Is this fear of exam? That's another day of practice. That's it. It would be easy for you guys if you stay confident, calm, and you maintain that attire head to toe what examiner is looking at. You all would pass this exam with ease, provided you feel that this is another day we have been practicing in the study group. Ensure that your communication is a positive communication. Ensure that you people have a very good diet before leaving. Bring the best on that exam day with all the confidence. Whatever you have been reading, be organized in speaking. Don't have a scattergun approach in terms of picking one point from here, the other from there. Go slow, take pauses, think what you're speaking, and always maintain your confident attire. I'm sure you people must have decided for the clothings for the exam. Please ensure that it's quite comfortable. Comfort comes first, and definitely it should not be very casual, should not be very bright or the floral colors and all. You can make some sort of a decent attire. If anybody has any confusion, you can definitely send pictures and we can select for you. But please have a good sleep. Do not worry about what's going at the back. I know a few of you are thinking about the kids as well. A few of you are thinking about back home as well. At the moment, I need your full concentration. Read the station very carefully. All right. Please ensure that whatever they're asking, what task they've given to you, if they're not asking for the history, please do not waste your time for the history. The station is going to be in front of you guys. You just have to read it thoroughly. If you have any questions, you can definitely in a structured discussion in the Viva, you can ask the examiner to rephrase or to elaborate or to expand on the question, but ensure that you're going in the right direction. Again, I would like to say that this is what you dreamt of. This is what you people thought of, that you are going to take this exam. And remember that day when you people were so nervous, ma'am, you're not getting visa. Ma'am, it's all been declined. What would we do? Today, by the Almighty's grace, all those steps have been done and you have reached your place of exam. Many could not. So you're amongst those lucky ones. Let's count the blessings and let's think about the positivity if we have reached to this place. Definitely, yes, that's for some reason. Let's give our best and let's do what we are here for. How do you guys feel? Asma, Batun, Mona, Nevin, Tahira, Shiny, would I get the best of the confidence from you guys? Give me a thumbs up. Would I get, thank you very much. This is what we need. Would we get the best of your performance with all the confidence which you guys have? We trust you. We have full faith in you guys, and you people have been working hard day and night. Now is the time, Tahira, my dearest, that we just have to prove ourselves to be the best. And you all have 100% potential, Mona. Believe me, you got to do this because you have been working hard for this. You all are very well prepared. I do not want any negative thoughts from this point onwards. I want positivity. Just take it for another day of practice. Do your best, and you people would see that we'll celebrate again with another link of celebrations on the result day. May the Almighty be with you guys. Good luck for all your efforts which you had been doing. May the blessings be on that day with you guys. Stay calm and trust yourself for that day. You had been working hard. You had been dreaming to reach this place. You had been thinking of that we have to take this exam and be over with this Ebcog. This is the time then when you have to believe yourself with full dedication, with full confidence. The support is with you guys. The prayers would be with you guys throughout your OSCE. We would be praying for you, and you would feel that there would be blessings in your words. It would be spontaneous. You would feel that the things and the thoughts and the discussion you've had with me, Camellia and Chin, that would be coming up in your mind, and you would have a very positive attire in exam. Let's spread positive vibes for the last 24 to 48 hours, and you people will feel the change in your practice. Chin, some last words for your students, please.
Yes. Again, from my end, like I said, you all are very well prepared. Just take the performance anxiety out of you. I know it's easier said than done, but do your best. Tackle every station as if you would have done it in your antenatal clinic or in your gynae outpatient clinic or in your triaging or A&E services. So you have prepared very, very hard for this. You have given your 100 or 200% into this. So just have to go into the exam hall and shine. That's the most important thing.
Perfect. I would like to add on that you all are part of us, and we would be praying for you guys. I can understand that the blessings are needed when it comes to hard work. We can do our best only, but at the end of the day, may the blessings be with you guys. May every moment of your OSCE be a blessed one. The words may be full of power and full of confidence. May you impress each and every examiner in front of you. Everything is going to be fine. You just need to have confidence in yourself, have faith in the Almighty, have faith in yourself, and just go for it. You have reached that place to be successful, nothing but successful. Love you all. Take very good care of yourself. With all these boosters, with all these energies, and with all these prayers, the entire RFA team wishes you the best of luck. Thank you very much for joining in. The racket would be uploaded so that the ones who are traveling, they would be listening to it. Again, we need your confidence. We need the best of the performance. You all would see that you'll do the best in the OSCE, and we would celebrate it together. Bye-bye from entire RFA team. Thank you very much. Bye-bye from Chin, me, and Camellia. Thank you. The backend team is also supporting and praying for you guys. Now it's your turn to have faith in yourself and just bring out the best. Thank you very much. Best of luck. We would be waiting for you in the study group with all the cherishing moments and with all the happy messages. Thank you very much. Best of luck and prayers. Bye-bye from our side. Thank you.
Thank you. Good luck, everyone.
Thank you very
Bye-bye.
much. They will do it, Jin. Thank you very
Yes,
much.
definitely. Bye-bye.
Thank you.
Bye-bye.
Bye-bye, everyone. Bye-bye.